Hi, all my sweet friends. So today's video is going to be a hygiene video. So I had about a month ago shown some of my favorite hygiene products. It's not kind of what I want this video to be exactly. I don't want it to be a haul of what I used. It might be a little TMI for some people and could probably maybe like cringy. If that's the case, you definitely can pass up this video, but you might get some helpful tips. Maybe take a chance, see if you might think of something, or you can suggest something for other people. It could be helpful. I know that hygiene is a very sensitive subject, especially for plus size people. I know some people who are plus size might be like, no, not for me, and I get that, but it has been just a sensitive thing for anybody who might be on the bigger side. There's that horrific stereotype that heavier people smell, and it's just, simply not true. Most of us plus size people take pride in our body, keeping ourselves clean and dry, and we are more conscious of it. So we tend to, overcompensate and make sure that we are fresh and clean. Not that thin people aren't as well, but you kind of get my drift. So if you're new to my channel, my name is Charlie. I love lifestyle videos, whether that's makeup, plus size fashion, plus size content, confidence, anything to help somebody out. That is my channel. Home decor, just a whole lifestyle channel. So if that sounds fun, entertaining, I would love you to stick around. I want to get right into this because I feel like this could end up being a little long, but helpful. So number one, excuse me, I have no medical training, so I want to put that out there. This is all of my opinions, and definitely do with that what you will. Now you might think, why does that seem irrelevant? Why does hygiene and medical have anything to do with it? Because I don't know, especially if you have you're a diabetic, you might need, kitty cat in the bag. If you're diabetic, you might have to be extra cautious about things that you use. I know my grandmother is. If you have multiple sclerosis, if you have any health related issues that can affect the skin, I know with diabetes, sometimes you can get a wound and you might not feel it, and it can fester and become an issue and doesn't heal. So, and even though that doesn't sound relevant, your skin is your biggest organ. It's so important to keep it clean and healthy. No matter what illness, you have to just really, really try. And I know that there are people that are of like super morbidly obese who have a lot of trouble, and I am very, very sympathetic to anybody in that situation. I never judge people because I just don't know what their situation is. Maybe they don't have help, maybe they don't have a home health aide, maybe they don't have family helping them. You just never know. They could be suffering from depression. And like growing up, I don't ever recall a time my mother sitting me down and explaining exactly what it was I was supposed to be washing. And I'm not gonna lie to you, it was when I became older and had resources like YouTube and TikTok and things like that. Well, not necessarily TikTok and YouTube, but like Cosmo Girl or Cosmo Magazine, when they would do hygiene articles, honestly is where I learned a lot of my things as far as taking care of my body inside out. And hygiene doesn't necessarily have to just mean your body. It can be keeping your clothes clean, keeping your socks clean, keeping your underwear changed, which might sound to like somebody who didn't know these things to be kind of like really like you should know that. But I am telling you now, especially teenagers, they don't always know, and they don't always have the resources to talk to people. So my main goal, I can remember I went to an OBGYN appointment. I was probably 28, and I had to give my family history. And I explained to him that I was had taken guardianship over my sisters after my mom passed away. And he said, like, what are your plans? Like as far as making sure you talk to them about being safe and sex and all this. And I don't even know why he brought it up to me, but he's like, the more honest without being vulgar you are, the better, because it's so important to be honest about these things. And that was a light bulb for me. And from then on, I educated them on hygiene, taking care of their body, consent. All of that is so important to your not just your outside health, but your mental health. Hold on 1 second, I will let you out. I will be right back. My dog is going ballistic. So that being said, I decided that I was going to start doing more videos like this, kind of like a vlog style, but maybe hitting hard topics. I noticed that with my daughter bringing more teenagers over, I've seen a lot of them I don't want to be like an overall judgment, but some of them I notice get very uncomfortable. They don't trust their parents, and they often ask me things. And I'm okay with that within reason. Like, obviously, I'm never vulgar. I'm never inappropriate. I just help when I am asked. When my sisters became young women and started to kind of blossom and grow and develop, I took it upon myself to then start talking. I feel like the earlier, the better, especially with the weirdos out there. It's very important to be anatomically correct, to give correct names to correct parts. All of that is so important. And you're probably thinking, like, what the hell does this have to do with hygiene? But I feel like it all is important with body and women's health, men's health, people's health in general. I just think it's so important that we communicate with our children. And I started very young with my daughter, especially teaching her how to wash properly. I always say to her, make sure you are cleaning your private parts separately from your body. Never try to cross-contaminate. And it can happen. It's not that big of a deal. It's all learning. Don't be too hard on yourself. And like I said, I'm 35 years old and I still get tips and tricks, and I still am amazed that I'm like, wow, I never thought of that. And some people might not think to clean behind their ears or to clean inside their ears, or that Q-tips aren't always the best, and to make sure they're cleaning their backside. And like, I know that meme was going around, or that video making fun of men for not washing their buttholes. Like, I'm not going to sugarcoat it. I don't want to offend anybody, but it's our body. And while it was funny, it's also sad, because you can't make fun, men are kind of like goofy, and they are like macho, and growing up you're told not to cry and you're not to do this. So why in the hell would they know to do these things? Like, I know to some people it's common sense, but maybe not to all. Do you know what I mean? My husband, with everything he went through as a child, hygiene is something that he is very crazy about. Hygiene is like his number one. He showers twice a day. There is no negotiation. He changes his underwear, which I'm sure he wouldn't care. He is my husband. He changes his underwear in the morning and in the evening, sometimes midday. It's just something that he personally does. He washes his face twice a day. He is like on top of his hygiene. He can't stand it. I don't know if it's something with childhood. I don't know what it is around it, but he does not enjoy feeling dirty. It's something that really bothers him. So like I said, there are all different types of hygiene products you can use. Obviously, you can get cheap stuff if you need to, or some people like to splurge and buy expensive stuff. I think it's unrealistic when you see some of these hygiene videos on YouTube or TikTok where people have 80 bottles of Dove soap. It's unrealistic. None of us can afford it, us normal people. We cannot. We're not making 10 grand a month on YouTube. We're not, if you are, congratulations. But if the normal people have a normal income, and going and spending $60 to $70 a week on hygiene products isn't in the budget for a lot of us. So I improvise, and I use what I can afford at the time. So the number one thing is, here's the number one thing, and I'm going to be very, very transparent. If you are having reoccurring odor, rashes, come on, kitty cat, get out of there. Come on, thank you. Sorry about that, you guys. If you happen to be having reoccurring rashes, reoccurring odors that don't seem normal, musty is normal, smelling kind of like a hoagie, that's normal. But when you start smelling something that is abnormal, it's probably time to check in with your general practitioner, especially if it's reoccurring, or if it's a rash. It could be yeast, it could be dermatitis, it could be all kinds of stuff, bacteria, vaginosis, it could be many, many things. I think that a lot of times, I feel like in my generation, I grew up early 2000s. So I was in 8th grade in 2002. I graduated in 2006. I always, and now correct me if I'm wrong, if you're around my age, let me know. And this is definitely going to be very personal. Do you guys remember feeling like your vaginal health, like the smell of your vagina was such an, like, it was so important, and I can remember everyone talking about it and how it should smell like this, and you have a stinky you know what. And I used to think like how uneducated I used to be, and the soaps that I used down there to make sure there was no odor. And I was so concerned, and I suffered for so many UTIs and so many yeast infections back then because I was so consumed with an odor down there when it should have a smell. It should smell like a vagina. Your normal odors, they range from no odor to very mild to a musty smell to maybe a little fishy, but not like a bunkery smell. Definitely could smell like bleach. It could smell like copper when you're closer to menstruating. Your vagina has many smells, as long as it's not smelling like rotten, or if you're not smelling kind of like fishy, then you could definitely be having an STI, an STD, or you could have an infection of some sort. But don't go through life thinking that you shouldn't have an odor. I can remember, and I'm definitely going to get her permission, but I'm sure she won't mind because of how important this is. My sister always was so concerned that other people could smell her area because she has a lot of discharge. And I would always tell her, no, I think it's just your body who is able to smell it, because I never smelled any odor on her ever. And she was very self-conscious about it. And I can remember being very self-conscious about it. And she calls me often and be like, Abba, like the other day, she calls me Abba, I'm sorry. She was like, my discharge is pale yellow. And I said, did you just get off your period? She said, yes. I said, sometimes when mucus and old blood mix, it can be pale yellow. Now, your only concerns when you want to come up, baby? With discharge is if it is gray, black, green, yellow, has a strong odor, or has a different consistency. Typically, a healthy discharge is going to be white. I know this all might sound for an older person, but maybe a teenager stumbles across this and might, save them a lot of heartache, because my sister panics. But anything that's stringy, white, clear, a tinge of yellow, and sometimes a tinge of pink, especially if you're close to menstruating or just getting off, and a little bit of brown is typically normal. If you are concerned, please consult your doctor. But if you have any questions for me, I'm trying to cover everything that I can think of that has helped my sisters in a panic, or my daughter. If there's change in consistency of your discharge, I definitely say consult a doctor. Typically stringy or like slimy is normal, but if it's like a consistency of cottage cheese, you could possibly have an infection. I'm gonna say you do. I can remember, this is again very personal. I'm sorry if a man's watching, it might be a little gross, but I will definitely put some type of warning in the description. I remember going to the bathroom, noticing that I had an abnormal discharge. I went to the doctors. It was, I believe, a severe yeast infection, if I'm correct. I feel like that doesn't happen. Maybe it was bacteria vaginosis, but I remember I took antibiotics and it cleared up in a few days. So don't get hard on yourself. If any of this happens to you, don't get down on yourself. A lot of that's going to cover younger women. As far as elderly women, my grandmother is 76 and she used to be extremely hygienic, and I noticed the older she gets, it's much harder for her to take care of herself, especially because she suffers with incontinence, things like that. And in those situations, you want to try to keep yourself as clean as possible. I know it can be very self-conscious for anybody that suffers from any type of incontinence, where they have any dribbling or they fully urinate. It's so embarrassing. And I can remember she had a big accident, and the odor was very overwhelming, but we just cleaned her up and moved on. And that's all you can do. It's really all you can do. You don't want to make anyone feel bad. My aunt is about 51, I believe she just turned. And this poor woman, you guys, I don't know what it is. They say it's psoriasis and yeast. Come on, get down, baby. Come on, get down. Go see, get down. This poor woman, from here under her breast, under her belly apron, down in the creases between where her labia and her legs are, her labia, inside her labia, everything, her anus is covered in yeast and psoriasis. I'm telling you, I have never in my 35 years, and I get rashes terribly, have ever seen something so painful looking in my life. And they say it's psoriasis, which she does, has always had them. And they also claim it to be yeast. But you guys, when I tell you, it splits, it cracks, it burns. The doctor said to her that her yeast infection in her vagina was one of the worst he'd seen in years, that he didn't even know how she was walking. And people might think like, what took her so long to get help? But you guys, sometimes it literally can happen in an instant. Something left untreated and maybe you don't even know can happen, and it was that fast. So there are so much, I feel like there is so much to hygiene, and this is just touching such a small little percentage of how important it is. And I don't categorize hygiene as just jumping in the shower. I feel like it's oral health, it's cleaning your clothes, changing your underwear, all of this. Okay, so maybe it's not just hygiene, maybe it's even like sex health, body health, all of that is so important to me. So the most important thing I think you should do is throw away your loofahs. I don't think they're hygienic, and I'm not judging you. If you enjoy them, that's fine. Just make sure you're replacing them every 4 to 6 weeks or washing them at the bare minimum. I just did away with them. I feel like they stay there wet and damp, and it's just such a waste of time and money, and it's just not good. Washcloths are amazing. You can get these so affordable. I think I got a 20 pack for $6. These are the kind that I like, the ones that are a little rough and they are crappy looking and gross, but they get the job done and they are amazing. I will use them for 2 washes and immediately wash them. That way I am not washing with like bacteria or any type of growth on them, and I wash these with hot water. My towels, I always wash with hot water because I notice unless I wash it with hot water, they do not get any type of odor out of them. And any type of residue kind of sticks to these, but you can get these at Walmart, you can get these at TJ Maxx and Home Goods, Ross, everywhere. Maybe just give it a try. So when I do shower, I keep one for my face and body. Well, I don't usually use these on my face. Maybe if I'm wearing heavy makeup, I might. But typically I wash with my hands and I triple cleanse. I keep one for my body, one for my private area. And I'm very gentle when I do wash my backside and my vagina, because if you are harsh on those areas, you can really, really have some irritation. So maybe skip out on the loofah if you're having maybe trouble throughout the day staying fresh. Maybe it's what you're washing with. Maybe you need that like abrasiveness that really scrubs that like layer of grime and from the day off. My suggestion, if you're someone who just wants to shower once a day, that's personally what I prefer. Winter, 1 shower a day. Otherwise, I am so itchy and dry. So I really make sure I take a good shower, and I prefer to shower in the evening. I don't know if it's like a mental health thing, and I don't want to diagnose myself, but I don't like to leave the house once I've showered. I don't like to leave the house in my pajamas. And I do not like to be touched until you have washed your hands or showered yourself. I'm very big on that. I don't know why. I don't leave I have my outside clothes, and I don't leave once I'm in my jammies. So if you want to do something, you better make sure I haven't taken my shower yet. And I take a nice shower. It's like the only time I have to myself where I don't need, my husband doesn't need something, my daughter doesn't need something, my dogs don't need something. Sometimes my husband will say, can I just jump in the shower with you? And I used to say yes, but I say no. It's not that I care. It's just that it's the only time that I just can take care of myself and I can just shower and enjoy it. I like my water warm. He doesn't. I just prefer to be by myself. So maybe if you're noticing that you can't stay fresh throughout the whole day, maybe see how you feel about a washcloth if you are. I also love an exfoliator for my back. I think that you can't reach your back and sometimes you don't think about it. I'm not saying everybody, please, if you do, don't just maybe plug your ears. This isn't for you, but some people don't, they can't reach it. My sister said to me, hey, how do you happen to wash your back? And she's 24. And I'm like, good question. So either I'll take this and I'll lay it as flat as I possibly can get it and kind of go like this, and then I'll pull it down and go like this. But I know some people have mobility issues. So what Walmart, like Dollar General, Dollar Tree, anywhere you can get hygiene products, they have a thing. So it's like a long, like abrasive rag used for exfoliated, and it has 2 handles on the end, and it's stretchy and it's great. Or get yourself like one of the loofahs on a stick or one of the brushes for a stick. They're fabulous and they are pretty affordable. I'll link some for you if you happen to be looking for one, but definitely try out some wash rags. I know they're kind of old school right now, but trust me when I tell you, the motion of kind of going like this is going to be what removes odor. Washing your hands is so important, you guys. I never realized, especially when people are going through flu season, COVID, and when the bugs, like, I didn't realize, like, I know this might be common sense, but I didn't realize with the stomach bug, the only way to not transfer it is the motion of wash your hands like this. I'm pretty sure, right, you guys? And make sure if you have long fingernails like me, using a little brush under your nails. It can't hurt, and you might not think there's stuff under your nails, but trust me, there is. Toenails are very important to keep clean. This is also a little TMI. I take care of my husband's toenails for him. He has, not only does he have like a sensory issue with it, it drives him crazy, but I believe he was cut as a child, and ever since then, he's a picker. And he had to go to the foot doctor, and they told him, quit picking your damn toenails, cut them square or have your wife do it. So for the past like 10 years, I've been in charge of cleaning under his toenails and clipping them. Is it disgusting? Yes. I've been married to the man for 17 years. I'm in charge of clipping toenails because he will pick. That is one of the worst things you can do, because if you are prone to ingrown toenails, which like my grandmother is, for God's sakes, don't pick them. Go to a professional. I know it can be like a pain in the ass and painful, but what's worse is if it gets infected. And I don't mean like a nail salon. I mean a foot doctor, if you can afford it. I know a lot of this is easy to be said, and I'm sorry if the video is going to be long, but I'm trying to cover important things that I think might be useful and helpful. And I'm trying not to give false information. I never want to be that person. Sometimes I watch these videos when the girls are like, make sure you scrub your butthole for 30 seconds, go in, rinse, and do it again, and make sure you scrub the folds of your labia. And I'm like thinking to myself, like, some of that can be dangerous. You shouldn't be suggesting that for everybody. And that can cause infections. It can cause tearing. It can cause a lot of issues. Of course, you should be cleaning yourself, but some people only need a little bit of unscented soap and water. So you definitely need to say this is not going to work for everyone, and definitely do what's best for you. So now what I have here is, one of these is gel. One of these is more of a moisturizing product. This is going to get you more clean because it is a gel. This is going to leave you feeling moisturized, but I don't feel as clean as when I use a gel. So I know it's a little much to have both. You definitely don't have to do Dove. They do make many affordable. I mean, this is affordable, but to some people it's not. I know that we are all in a pinch right now. Even if we're making good money, we want to try to save with the cost of everything going up. All you need is something that really gives you clean. So ditch this if you are looking to really scrub and clean, and get yourself a gel. Lately, I have been going for the Suave. It is under $3. It smells amazing. This is mango, citrus, and tangerine. They have about 4 different scents. I think they had this, cocoa butter, vanilla, and maybe like a peonies or rose. I'm not sure. Maybe a sweet pea. I don't know. This is going to be you're going to love it. I promise you, you're going to love it. This is going to replace anything that you use that's expensive. This makes me feel clean, but I don't feel tight and dry, if you get my drift. Like, you know how you feel super tight after the shower? I don't think you'll feel this that way with this. So I'll go over. I use a lot of soap. It's just something that I enjoy doing. You definitely use what you need. After I wash my face, that is the very first thing I do. I remove my makeup. I get in the shower. I usually pin up my hair if it's not hair washing day, and I immediately wet my entire body. That way I open up pores, I soften my skin. So for about 15 to 30 seconds, I just get every part wet. I take my hose, I spray down my body, I spray down my belly apron, everything, get it nice and wet. Then what I do is I go in and I take quite a bit, but then I begin to really lather it up. I know this might sound silly to people that this is like, should be obvious to, but there are people out there struggling. Immediately, I will wash my armpits really, really well because I wear deodorant and I want to get any buildup out of my armpits. This is TMI. I do not shave my armpits unless I absolutely have to because it is irritating. You want to come up with mommy while I'm talking? My armpits are irritated. Come up, baby. I'm not going to pick you up because you're nippy today. Come on. So I start and I get my armpits. Come on, jump up. Do you want to come up? Come on. Come on, baby. So I wash my armpits really, really well. Get any type of residue out of them. Rinse and repeat. Then I go under my breasts because my breasts are quite large and it kind of sits and hangs. I have to lift my boob and wash. And sometimes I get like little pimples under my breast. I try not to pop them because I know it's really, really bad. But it's like, how could you not? Do you know what I mean? So I really, really scrub if I notice that I'm getting any type of pimples underneath because my breasts are so heavy and they lay. Sometimes I'll go in with like a salicylic acid, but I don't really need to that often. And I just start scrubbing. And then I work my way to my stomach, belly button. One of the most important things, especially if you're heavy, that belly button can sting for anybody. Make sure you just like maybe go like this and kind of just clean in there, rinse it really well. But you got to make sure you're drying your belly button because I am telling you right now, you do not want yeast in your belly button. It will itch and smell and you will be very miserable. So clean under, in there really well, rinse, and then you do underneath your belly apron if you have it. If you don't, continue just washing your stomach. Arms are very important. Make sure you're washing your arms. I know that's silly. And before I even start any of this, the very first thing, I know it's like a weird thing, I never thought of it till recently, is I wash my hands first because my hands are filthy. I'm touching things all day long. Then I work my way down my legs. I skip my vagina and my ass, my butt. I wash my legs and I get between my toes. I love the feeling of cleaning my feet. I know that might be weird, but it is so important. Now, if it's not hair washing day, I try to wear a double thing on my head. So I wear a headband and a bonnet. I clean the back of my neck and I carefully clean behind my ears because you just don't think about it. I know it's weird, but if you're washing your hair, your neck's gonna get clean. But if you're not, you need to remember, I always wash here, especially here because I'm always wearing makeup. And then I rinse completely, start over, and do the same routine again. So I would usually use the gel first, and then when I go to do my second cleanse, this is when I would use my moisturizer. Summertime, I do typically shower twice because I'm sweating, I'm doing more. So I'll take a very fast shower in the morning and take my evening shower. Typically my shower routine is anywhere between 20 to 45 minutes. If I'm washing my hair, of course, it's going to be the full 45 minutes. This is what I wash my face with. You guys, I'm trying to do this as quick as possible, but be as informative. I want to keep this under 30 minutes because I know that listening to me talk could probably drive you nuts. It can be boring. But this could very well help you. Dove soap. This is fabulous. This is the sensitive, fragrance-free, hyperallergenic. Keep 2 in the shower. Make sure you don't mix them up. 1 is for my face. 1 is for my private area. I also love the liquid form of this. I had it upstairs, I should have brought it down to show you. I'll pop it on the screen. That is fabulous for your private areas as well. You also could use whatever you want down there, or soap if that is what you see fit. For men's care, my husband really loves this Dove Care. This is the sandalwood and cardamom oil. This is very, very nice, moisturizing, and he also has been liking the Cremo in the bourbon vanilla, but he'll use good old Irish Spring. He's not particular because he goes through so much body wash. He's not very picky. For your armpits, my poor husband gets rashes under his arms. So we have, this is not sponsored. I buy this. It's very pricey. It's right around $13. This is the native. This one we tried was the sandalwood and shea butter. So when you start using this, don't be alarmed if, you have a little bit of odor at first. I feel like you have to detox your armpits from all the shit you used before for this to truly work. Because at first he didn't love it, but now he swears by it. This is aluminum free and baking soda free. I don't know if baking soda is bad for you. That's the first time I saw that. So definitely you could educate me down below and let me know. I know aluminum is terrible. So this is amazing. I use aluminum deodorant. Someone suggested Suave. Thank you so much. When this is done, this is my last bottle, but this is good and this smells incredible. This is the Sexy Lingerie and it's affordable. It's like $5. Why is deodorant and feminine products so expensive? Please tell me. But my lovely friend on here, I can't remember your user handle if I can find it. Otherwise, thank you so much for recommending Suave. I have no idea why I didn't think of it, because my mom always did. So right on to when you do your backside and vaginal care. I don't know much about men's hygiene. I would assume that you would lift your testicles, wash them. I'm not laughing because it's funny. It's just funny to say. And then I don't know if men clean the actual penis itself. I don't know much about that. I don't have one. And I never thought to even ask my husband like what he does. But for us ladies, I do make sure I take good care of my backside because I have had issues back there. I had hemorrhoids years back. You guys, it's so silly. I'm not laughing because it's funny. It's just, it's the immaturity in me, I guess. What I do is I usually use like the sensitive skin that has the moisture that comes like this, something with moisture. Now, I'm not so particular about my backside, but my vagina, I am very. But I always wash my vagina first. I never do front. I do front to back, not back to front. So I will wash my vagina first. However you felt need. Never, okay, I shouldn't say vagina because people can get confused. My labia and the folds, like when you open it, but I never wash where you would insert a tampon. That is self-cleaning. Okay, so a little story. I was very confused growing up. So I would always tell my grandmother that I wash my vagina, and she would always say to me, that is terrible. So she was thinking I was actually washing where you would insert a tampon or a douche. But no, I was actually washing my labia. But again, that goes back to always, like I had a cousin that always talked about vaginal smell and I never understood. And she made such a big deal about it. And it used to make me paranoid. And in my early years of my marriage, I used to douche and it threw my pH so bad off. And I was always so dry and uncomfortable down there. Your vagina itself is self-cleaning. You don't need to do anything to clean that. And if you are having odor, that's when it's time to see a doctor. So I clean my area. I am fat. I am very overweight and I have extra skin. So I take particular care. So if this is the vagina, the sides that kind of stick to my leg, just move it aside and scrub there. That is where I need to keep clean, especially there and under my belly. And then I'll go in with a little extra soap and clean my backside. Now for the vagina wash rag, only one time if you can possibly do that. Try not to reuse it because then you could be cross-contaminating, especially if you worked all day, maybe only use that one once. Rinse really, really well. Try not to ever leave soap, and try not to get soap in your urethra, because that can cause not only pain, but a urinary tract infection. You don't want to do that. Trust me from experience. Then when I get out of the shower, that is probably the most important thing. I was hollering at my husband the other day, telling him, stop being lazy and throwing clothes on while you're still damp. That is why you will get a yeast or be itchy or still can hold odor. If you're overweight and you didn't dry underneath your belly and that moisture sits, not only can it cause sores, odor, and a rash, it's gonna be painful. So make sure if you are drying. My doctor, I remember her telling me, if you need a blow dryer, get in there and blow dry those areas good. Dry yourself. I can't emphasize how important, especially plus size, it is to keep yourself dry. This is going to be a lifesaver. My husband uses this all the time. This is just baby powder. I'm sure this isn't the best. It doesn't look like it has talcum. Baby powder. It's going to keep you dry as possible. That's all you can do, is try to keep yourself as dry as possible. Changing your underwear is very important. Changing your socks. Your feet, they need to remain dry. You do not want athlete's foot, trench foot. Is that what it is? Your feet are so important to keep them dry. I don't remember what had happened. My husband was fishing. His feet were wet. They were so bad. I was so afraid that he had some type of fungus. Thankfully, we did not. Did you know that jock itch and athlete's foot is treated the same way? I was surprised too. I'm sure I'm the only one that is surprised. What's the matter, honey? I know you are still very stressed. I'm sorry. We had a foster puppy come. We were going to try to foster, and Gilly is still kind of babying today. So those are the tips that I have for right now. Now, I know some people, if you're in a jam and you need a little bird bath, I get it. It's not always going to work this way for people's lifestyles. And, you spray your perfumes, your deodorant after you get out, your powders to smell nice. But the most important thing is your mental health and taking care of yourself. Try your best to take care of yourself. I know that mental health can make you not want to even get out of bed. I get it. I know it's horrible, but maybe try today to force yourself. Maybe if you just brush your teeth today. Oral care is something totally different. I have been taking my oral care up a notch and really, really, really making it a priority in my life. I have never been somebody who hygiene has never been affected by any mental health that I have, thankfully, but I know it does. I know there are people that just can't manage to do it today. And if you can't, you guys, today, if you're struggling today, that's okay. Take the day. Don't punish yourself. Tomorrow, maybe you can brush your hair, or tomorrow, maybe you'll be able to take that nice long shower. Don't punish yourself, but just think about it this way. Think about how good you'll feel. Think about that it could be the one thing that just triggers you out of it. Maybe it's the one thing that just pushes you out of it. Maybe you take that long shower tonight and it pushes you out of that terrible headspace. So if you have any questions, nothing is off the book, you feel free to leave it. If there are any topics you would like me to hit, absolutely let me know down below. Like I've said in the past, I am not easily offended. I am somebody that most people in my life come to when it comes to sex, or when it comes to education with those things, or hygiene. I'm typically the one answering the questions, and I've just always been very open. It's something that even my whole family knows. Even my older family members come to me, and if I don't know, I try to find out for them. My aunt loves to make fun of me because I am so open, not in a malicious way. I'm very, very open with my sexuality, with cleaning, with sharing. I know for some people it's too much, and I get it. I definitely have the too much gene in me, but I feel like it opens windows for people to be comfortable sharing. So That's why I'm doing this today. This isn't your typical hygiene video where I kind of haul the products and show you how I use them or shower with you. But if you have any questions, concerns, I will answer them as truthfully as I know. And if I feel like I don't know the answer to them, I will definitely tell you, maybe consult with somebody. Because again, I am not a doctor. I am not a nurse. I have no education in the medical field. I just know that these are things that have worked for me and experiences I've had having my older grandmother or sisters, teenagers. Also, I could talk about periods. I have vicious periods. I am due for my period soon, and it is knocking me on my ass. I feel like hell. And I can also show you some of the products I use. I don't use tampons typically. I strictly use pads. And I'm definitely trying to look into reusable pads because I have such issues with pads. So if you want to hear about that, definitely let me know. I'm keeping this hopefully around the 30-minute mark. Sorry if this felt very long. I'm not trying to preach to you. I just want to be helpful. This is what my channel I want to be, is just helpful. So if you have any questions, feel free to leave them down below. I love you all, and I'll see you in my next video. Bye, guys.